ADHD should be diagnosed through a thorough assessment process. There are a number of semi-structured diagnostic interviews, so there are approved assessment processes. As a psychiatrist, my initial role is to take a general psychiatric history, and that just means exploring someone's background to see whether they've had mental health difficulties, to get a better understanding of the nature of the symptoms that they have. With ADHD, what I'm interested in doing is excluding any other mental health problems. We know that one of the core symptoms of ADHD is poor concentration. That can occur in a number of other psychiatric conditions, for example, depression. So it's important to make sure that there isn't another mental health issue that's going on. Once we've done that, we can focus a bit more on the ADHD symptoms. And it does rely on the memory of the person and their experiences at a younger age and through the educational system and into their adult life. So there are particular things that we'd look out for in terms of their recollection of how they got on at school, how they performed with their homework and undertaking various tasks at a younger age and as adults. Of course, it's difficult for people to remember some of those things in detail, and we would also want to have some objective sources of information. Two examples would be that if there's a relative around who's known that person from their childhood, given that the onset of the symptoms is usually during their childhood, that's a really important part of the process, as is digging out the old school reports, because those can help tell the narrative of some of the difficulties, again in a very objective sense. So the key aspect is to try and triangulate those different sources of information, because there might be instances where an individual feels that they identify with the symptoms of ADHD, but either there's a better explanation for why they have some of those symptoms, or it's not quite backed up by the recollection of their parents, for example, or the school reports, or what teachers would have said in parents' evenings. So that would be the ideal scenario in which an assessment is thorough, it's detailed, and then towards the end of the assessment, I would feed back to the person I've been seeing as to whether or not I feel they have ADHD or not, and if they do, we will then discuss the treatment options.